Introduction to Pathology. Dr. H. Zahawi, FRC Path. Study of Medicine and Disease. Greek, pathos. Pathology is the study of suffering. Disease is disease. Egyptian, Arabs, Greece, Rome, Middle Ages. Scientific Revolution 16th, 17th. What is pathology? Study of disease by scientific methods. Individual's reaction to injury and its effect on body. Effect recognized by structural and functional changes. Pathophysiology. Result is either compensated, decompensated, or causes death. Links basic science to clinical practice. History of pathology. Father of pathology. Anism. Influence of magic or supernatural. Deficiency or excess body fluids. Hippocrates. Father of medicine. Postmortems and gross pathology, 300 BC. Van Leeuwenhoek microscope. 17th century. Study of cells. Rudolf Virchow. Father of pathology. Tumors. Morbid anatomy. Cellular path, microscopes. 17th, 19th century. Pathology in the 21st century. Many new techniques. Electron microscopy. Genetics. Know the normal before the abnormal. Subcellular. Molecular. Branches of pathology. Anatomic pathology, study of tissues or cells. Postmortem examination, autopsy. Forensic pathology. Surgically removed specimens. Cytology of smears, fine needle aspiration. Clinical pathology. Clinical chemistry. Hematology. Microbiology. Immunology. Genetics. How pathology is taught. General pathology studies mechanism and the characteristics of principal types of disease processes. For example, cell injury, inflammation, neoplasia. Systemic pathology studies specific diseases in specific organ systems. For example, lung abscess, breast cancer. Steps in study of diseases. Epidemiological aspects. Etiology, identifiable cause of disease. Intrinsic, genetic. Extrinsic, acquired. Idiopathic. Pathogenesis, sequence of events and the response of cells and tissues to the etiological agent, from the initial stimulus to the final expression of disease. This response can be studied morphologically, biochemical, immunologically or at molecular level. Pathological and clinical features including biochemical tests, radiological findings. Integrate all information. Complications and sequelae. Events taken during the disease process that may impair full recovery. Treatment. Prognosis. A forecast as to the probable result of an attack of disease and the prospect of recovery. To aid diagnosis, study morphology. Samples for study include cells, biopsy or whole organ. Gross or macroscopic appearance. Histological or microscopic appearance. Electron microscopy or ultrastructure. Genetic and molecular methods may aid diagnosis. Sample case. A 60-year-old woman with a lump in the neck of 6 months duration. Patient has fever and raised BMR, ESR. On examination she also had enlarged inguinal lymph nodes. Further investigations were within normal. Biopsy was taken, i.e. tissue removed from microscopical exam. Follicular lymphoma. Genetic studies. Translocation T18, 14. Treatment, chemotherapy. Prognosis, Good. Basal cell carcinoma. Opened uterus with leiomyomas. Gross. Microscopy. Gross. Electron microscopy useful in some cases,